physicians for joining us in the Doximity team. I'm Teresa Snow. I'm the Executive Director of Strategic Communications at MU Healthcare, and my colleague Katie Henke, who works most directly with our partners at Doximity, is also on the call. So I will not be on the call the whole time. I have a QOR for our team today, so I'll be dropping off in a little bit. And Katie will be on to answer questions and to capture your comments for our team. As well, Katie will be summarizing the presentation and updating our website. So anytime you can see information about Doximity and our engagement at muhealth.org/Doximity-info, and I'll put that in the chat. Just let you know why Doximity matters. I'm sure I'll leave it to the Doximity team to explain, but they're the largest community of healthcare professions in the country. I tell folks it's like the LinkedIn for doctors, but they probably wouldn't like me comparing it in that way. Physicians who are verified on Doximity are able to vote in the annual US News and World Report rankings of best hospitals and specialties. And Doximity accounts for nearly 1/3 of the score. I can tell you that of all of our MU Healthcare School of Medicine UP physicians, everyone but 33 docs was verified this year. We sent out special emails to chairs to say, here are the 33 that haven't verified. Can you get to them by the November deadline? So hopefully we'll, 100% verified physicians would be awesome, but we're really close. Doximity matters because we've engaged Doximity, paid money for a partnership to raise our reputation, our brand image of MU Healthcare and the MU School of Medicine, to share content on the feed, to connect with different colleagues, some of our leaders. And so as part of that engagement with Doximity, we have this Grand Round seminar for you as well. So with that introduction and me putting the link to the website in the chat, I will pass it over to the team at Doximity. Thank you.
Thanks, appreciate the intro, and good morning or early afternoon to everyone. Appreciate you guys making time today. But yeah, just wanted to give an overview of the Doximity platform overall, some of the profile and workflow tools, and would definitely like to keep it more conversational. So please jump in with questions or thoughts or anything like that. We'll make it a little bit more engaging for everyone. But just brief intro, my name's Zed. I'm an MD on the strategy team at Doximity. I initially came to tech because I was super interested in the potential for digital health to improve both physicians' quality of life as well as care delivery and efficiency. So Doximity from that standpoint has been a perfect fit, and we'll talk more about that. But basically a big part of my job is working across several teams to help ensure our products and our user experience are developed with kind of that constant physician first mindset. So jumping in sort of an overall overview, our mission is just making physician lives easier, more time for medicine. And we'll touch on all of these in more detail, but you can think about it as a LinkedIn for physicians, but there's definitely more functionality involved. And so it's kind of a professional network for healthcare. And so we really do strive to be physician first in everything we do. And additionally, as mentioned, Doximity members can participate in US News Best Hospital surveys. So we sort of serve as the digital ballot box for that voting. Also at the end of the call, there are some of my colleagues are on the call as well to help people with signing up or signing into Doximity, as well as to answer any questions that come up. So moving into today's agenda, we'll just cover sort of the 3 pillars of the platform, profiles, news, and workflow. And we'll go ahead and start with profiles. So of course, your profile is sort of your central starting point for Doximity. And every physician has a profile. Doximity is able to pull in a lot of data from different sources to pre-populate your profiles to save you time. So there's not much of a lift on your part in terms of going in and filling out this kind of tedious profile. And we also provide a lot of automatic updates throughout the year. So as you can see, the average physician profile gets about 30 automatic updates each year. And Dr. Chris, hopefully I'm pronouncing that right, has given us permission to share his fairly robust Doximity profile. So this is just kind of a glimpse. We'll sort of scroll through what the profile looks like. It starts with a summary, which Dr. Chris has entered here. And then we get into clinical expertise. And all of these parts of the profile are are able to be edited by you, the user, and Doximity also pulls in additional information. So as you can see, we'll go through clinical expertise here, and then into work experience, as well as education and training. And again, our job is to keep the CV updated for you. We don't want it to be something that you have to spend extra time and attention on. We're able to pull in a lot of these awards, as well as clinical trials data from different resources. In addition, publications and presentations we're able to keep updated for you. In addition, sort of visibility is a huge part of the profile. So Doximity profiles automatically sync with US News Doctor Finder profiles. So ultimately, roughly 85% of physicians are on the first page of Google because of their Doximity/US News profile. So if nothing else, this just helps with your personal and professional visibility in a Google search, or when other physicians or patients are searching for you. This also kind of lets you naturally control two profiles in the Google search, since your US News is updated via Doximity. So another example here with Dr. Kim, the first three results, as you can see, are MU Health, and then you get the Health US News website, and then Doximity. So that just speaks to in terms of the visibility. So if anything, just claiming your Doximity profile can do a lot for your brand. Any questions? All right. So this just goes a little bit more into detail as you're looking through the links. So this is the US News link on the left, and then the Doximity profile link, how Dr. Kim will appear with the Doximity search. And Mayo Clinic specifically has claimed, or likes to emphasize, the use of Doximity profiles to their physicians, as their public profile is prioritized as having the most relevance. And so that covers most of the basic profile information. I'll pause there. Any questions on your physician profile on Doximity? All right, so we can now move into sort of the news feed. And this is basically Doximity's way of keeping you up to date on the relevant medical literature and resources in a way that's most efficient for you, the user. I think we're all pretty familiar with how hard it is to keep up with all the medical news and literature these days. For example, just this one stat, there are about 23,000 new COVID literature papers published, and this is doubling every 20 days. And I don't know about you, but I top out about 20,000 articles per month. That's about my limit, but no, so it's a huge influx, and it's difficult to keep up with. So Doximity's sort of our goal is to make this information as accessible and easy for you by sort of building a compilation that's most relevant based on your user habits, interests, skills, as well as your network. So help you keep up with the most important medical news within your specialty. So this is just a breakdown of what your news feed would look like in the platform. Basically, you're able to scroll through like you can on multiple platforms, and you'll be able to see the different journal and article cards and click into them to read the full articles and the full studies. But it is personalized for each verified clinician on the platform. And we do feature news on the latest research and drug approvals, et cetera. And that sort of saves you the hassle of sorting through from multiple sources. It's all here in your news feed, saves you the time from having to log into separate publications and all the sort of influx and inbox overload that we see. You're able to, from kind of a social standpoint, you're able to see articles your colleagues are reading, get updates from your preferred sources, as well as earn CME credit for articles and studies you'd likely read anyways. In addition to some of these more academic sources, there's also relevant medical news from more mainstream sources, such as Wall Street Journal or The Atlantic, and that helps provide insight into what your patients are reading and kind of the information they're working with as well. There's also a digest we send out just once a week. Again, we want to avoid any type of inbox overload or draw on your time, but this is just sort of what we feel are the most relevant, important articles for your specialty, your practice, based on, again, on your interests, as well as reading habits. And just kind of, again, as Dr. Kanadra speaks to here, just helps you navigate those excessive influx of emails and articles. Also in our newsfeed, we have these features that we call op-meds, very similar to op-eds, but these are all written by Doximity users, physician users, and just provides an outlet for topics that various users like to discuss. And these are, again, some of our most engaged newsfeed articles. And so you can see a variety of the type of op-meds that are published on the platform here. And as described here, it just provides some users this kind of option to reach out to this vast Doximity audience, compared to other platforms, which are a little more generalist in their readership. And so this is one outlet. And if you're interested in publishing an op-med piece, we have kind of contact email here. But yeah, so that's the op-med part of our news feed. And I'll go ahead and pause there. Sure.
Just threw in chat that our team can help with op-meds. What would be the best thing to do for them to have an idea and us to connect with you to say, yeah, that's worth writing on, or for them to start writing? Because if the physicians write, our team can edit, we can refine, we can fix the punctuation and make it sound right. But should we check with you on what to write on first?
I think, and Tosh on my team may be able to speak to this more, but our job isn't so much to decide what topics are good. I think we have a lot of trust and faith in that whatever the user comes up with or finds worthwhile to publish or put out there, that's fine. So I think it makes sense for you guys to get your piece together, edit however you want to, and then submit it for publication. And we're happy to provide feedback, but we're not going to tell you whether a piece is worthwhile, because it's valuable to have a lot of different opinions and perspectives within the newsfeed.
You're seeing a lot about physician burnout and some of those topics that are doing well in the op-med.
Right, that's correct.
I will say we often ask Addison for tips on trending topics, so we're able to provide some of those that Doximity does see, and I'm happy to pass those along to any physicians who might be interested in submitting a piece to the op-med.
Great. Any other thoughts or questions here? All right, so we'll move into the workflow, which is honestly my favorite part of the platform. Of course, we've covered profiles and news, and so workflow is where kind of the rubber really meets the road in terms of making physician lives easier and more efficient. So I think we're all familiar with various studies around this topic, as well as articles in terms of how much time we spend on the computer versus actually visiting with a patient, which is pretty horrific and drives us nuts a lot of the time. But a lot of Doximity's workflow tools are, I think, really represent our physician first attitude and how much thought we give to specific ways to make physician lives easier throughout the day. So we'll get into dialer first, and this is the just the voice dialing part of our dialer function. So this basically enables you to use your mobile device to call your patients without using *67, without your patients receiving block calls, without giving your patients your mobile phone number. You're actually able to enter whether your office number, your clinic number, whatever professional number that you want to appear on your patient's phone is what will be displayed on your patient's phone when you dial them. So it gives you a lot of flexibility as well as mobility to do office work from your mobile device. And again, as it says here, it displays your office or hospital number. And again, you're not tied to your desk. You're able to make some of these calls wherever you may be to be a little bit more efficient in your practice without providing all of your patients with your personal phone number. And this is a new physician favorite, which is just really seen skyrocket physician use, is our telehealth product, Dialer Video. And I think the real beauty of this product is it doesn't require any additional downloads or tech savvy on the patient's part. So it's very simple to dial your patient's number from your either mobile or desktop device. And you can see here sort of in these pictures how it looks both on your phone and the patient's phone. So when you dial your patient, they'll receive a video call invite. So you'll just send the invite, and all they receive is a text with a link. And so they don't have to have their own patient Doximity app. They don't have to have a special patient portal. They just receive this link, which they're able to click, and it automatically opens the telehealth visit in their video browser, So and the visit starts, and this just cuts down on a lot of issues with maybe some of your patient populations that are less tech savvy or don't have as much familiarity with how to use or download certain apps, et cetera. And so, as well as on the desktop dialer product, you're actually able to screen share as well. So you can show your patients various imaging or whatever labs, et cetera, you want to be able to show them right from the telehealth visit. And these are just a couple of endorsements from various academic bodies, but again, I think they speak fairly strongly to what we're able to deliver with our dialer product. I'll just read one briefly, but in our experience, this Doximity dialer is the easiest way to connect with patients outside of approved portals. So we'll hear a lot of physicians say when their Epic portal breaks down or whatever they end up using for their hospital, they'll jump onto dialer as a quick sort of easy button, or they'll place the call first with dialer just because it is fairly simple for both physician and patient.
We do have a question from Dr. Yes. Yeah. We've got one in the chat from Dr. Alsamari. He's wondering if the dial option is available outside of the United States.
Gotcha. That's a great question.
I can comment on that, Katie. So right now the feature is only for US-based calling, but that is a request we've heard. So we'll definitely take that back to the product team. Right now it just supports US-based numbers.
Thank you. I will say Dr. Kaitan says, I love the Doximity dialer on my cell phone so I can call patients from my office number virtually. So he has some praise there too.
That's great.
Oh, that's so good to hear.
And I think a lot of physicians are used to using it on their mobile, but I think less well known is that you are able to use it also on your desktop or laptop as long as you have sort of the video functionality enabled. And then that gives you a little bit of a few extra tools in terms of sharing your screen, et cetera, with patients. So that can be valuable too. Any more questions or about either functionality or in general? All right, I'll move on to search. So this is the search function on Doximity. You can search for basically any US physician or practice, et cetera. So basically this video will just kind of walk through. If we type in ortho Missouri, we're able to filter both by hospital as well as city. And these are some of the initial results that show up in terms of physicians. And as we scroll down, you can see the brief sort of bio, their specialty, their practice area, and some of their skills. And if we click on a specific physician, Dr. Chang, this is the sort of, this is I guess the functionality that'll pop up, and you're able to add the colleague, you're able to share the profile, you're able to send a secure message, and then you also get information on their office and their contact information. So very helpful for referrals, looking up different colleagues, et cetera. Another of our dialer functions that we find a lot of physicians find very valuable is this straight to voicemail feature. So this is a feature that basically is built so if there are conversations with your patients that don't necessarily merit like a full-on follow-up conversation, if you just want to relay some information or results very quickly, or if you're outside of normal working hours or it's late at night, you're actually able to use this straight to voicemail feature, which will dial your patient's number straight to their voicemail. So you're able just to quickly convey some information without necessarily having a conversation or playing phone tag. So that is another one of the dialer features. Moving on to fax. So Doximity platform enables you to basically use your mobile device to send and receive faxes, which has actually been seen even more increased use during this COVID time and getting information across the different hospitals and health systems that we might not usually work with. But every physician in the US automatically receives a free eFax number from us. and you're able to send and receive faxes. Basically, you're able to use your phone camera to snapshot documents and send them as a fax to other Doximity users. It's all HIPAA secure and free for life. Of course, you can include attachments, sign documents, annotate PDFs, all from your mobile device. Any questions on either of those features? Well, that really, I know we moved through it pretty quickly, but that wraps up kind of the overall look at the Doximity platform as a whole. Feel free to jump in with any thoughts or questions now. Also, here's contact information for our team members, as well as you can schedule a 15-minute call. And yeah, please let us know how we can help. And your feedback is always very welcome as we continue to iterate on these features and products.
Can you talk more about the why? Why would somebody take the time? One of the physicians in chat said, I try to click on the links and I have trouble with the links. I get an error message. I mean, another platform, like why, can you tell us more about, like I want physicians to engage because we are working on the US News and World Report vote and the results of that vote and how that reputation will affect our health system, but collaboration, like why? And maybe our physicians can talk a little bit more about how it's useful to them. Love to share the why.
Sorry, how what specifically is useful? So I missed that part.
Different features of the platform.
Okay.
I mean, you've mentioned others on the call could share, or
yeah, I'm happy to
anecdotes from other physicians who say, hey, my practice grew because I did this, or I connected in this way and I saw this result.
Yeah, happy to share some information. Just quick background, I've been a Doximity for probably eight or 9 years, and I feel like I've met 50, 60,000 physicians along the way. So that's the perspective I'm sharing from. But the main reason that a lot of doctors just use Doximity is the quick time-saving features. Everything we've been doing is designed to save you the extra minute, so you don't have to, worry about some of the day-to-day stuff that takes a lot of time. So whether it's news or communicating with patients, that's really why doctors use Doximity. But I would love to know from anyone on the call what features that they love specifically, or if there's anything that we can do in terms of building new features that might be helpful to you. I'm glad to hear Dialer has been pretty helpful. That's really great to hear.
And Tosh, I'm not sure if you saw, but it looks like we had another question in chat about other healthcare providers and their access right now on the platform. If maybe we can touch on that, that'd be great.
Yeah, so the other providers can use the features in Doximity. I know as of late, a lot of the providers have found the Dialer features useful, so they can join and use Dialer just by joining their physician's care team. And we're happy to walk you guys through that. If you want to email Cole, I think his email's in the chat. We can walk you through how you can use Dialer via your physician care team on Doximity.
One thing to note just about that access is available right now through December, but that access would be limited moving forward outside of an overall agreement with an institution for extended care teams.
Great. Any other questions we can answer?
Yeah, I know everybody's eating, but
Yeah.
in the call early if there's more questions. Katie, do you have anything? Anything that would be helpful to you in working our content partnership on the team?
Not that I can think of at this time.
No. Okay. Thank you all very much. We'll put a summary on the Doximity page. And I essentially set something up myself, snowt@health.missouri.edu. Katie Henke. Is it Hanky? I'm on the chat here. Hanky.
Yep.
Okay.
HENKEKE. I can throw it in there too.
Yeah, do that.
Yeah.
Jones, I just threw my email in there and Katie can.
Yep.
As well.
Great.
Great.
Well, thanks for everyone's time. Yeah, and feel free to follow up offline too with any other questions or thoughts. But yeah, really appreciate it.
Thank you.
Thank you all.